अब चलिए अपने सेशन को आगे बढ़ाते हैं। अगला सेशन जो है वो भी बहुत दिलचस्प है क्योंकि वो है स्वास्थ्य के क्षेत्र से जुड़ा हुआ सेशन। हमारा अगला सेशन जिसकी थीम है आयुष्मान भारत अजय भारत यानी हेल्थ इंडियाज न्यू वेल्थ। इट्स अ वेरी इंपॉर्टेंट सेगमेंट टू डिस्कस एंड अंडरस्टैंड एंड फॉर दिस वी हैव मिस्टर अनुपम सिबल, ग्रुप मेडिकल डायरेक्टर ऑफ अपोलो। उससे पहले अपोलो हॉस्पिटल के बारे में आपको बताना चाहूंगी कि अपोलो हॉस्पिटल्स ग्रुप हैज 73 हॉस्पिटल्स, मोर देन 100 clinics with a presence in quaternary care, tertiary care, secondary care, primary care, IT, education, research, project, consultancy, pharmacy, retailing and telehealth. मैं बुलाना चाहूंगी इस सेशन के मॉडरेटर मिस्टर श्रीधरन को, वो मंच पर आए और मिस्टर अनुपम सिब्बल के साथ सेशन को आगे बढ़ाएं। लेकिन उससे पहले मिस्टर अनुपम सिब्बल की जर्नी पर एक नजर थ्रू एपी।
Named after the Greek god of medicine, Apollo has grown into one of the largest healthcare networks in the world. In 1983, founder Pratap Chandra Reddy started the first Apollo hospital with 150 beds. His entrepreneurial journey went on to transform India's healthcare landscape. Today, Apollo is one of the largest healthcare providers in Asia, with over 9,000 beds at more than 54 hospitals in India and abroad. Today, under the stewardship of Professor Anupam Sibal, Group Medical Director, Apollo has put in place a team to look at cutting-edge innovation in the healthcare industry to keep Apollo at the forefront of quality care delivery.
When any patient walks into the hospital, the patient is most worried about outcomes. We at Apollo developed ACE, which is Apollo Clinical Excellence in 2008. We chose 25 parameters that were mission critical. We believe our patients need to know about outcomes, and we've started sharing the ACE outcomes on our website.
तो जोरदार तालियों से स्वागत करिए मिस्टर अनुपम सिब्बल, ग्रुप मेडिकल डायरेक्टर ऑफ अपोलो। और मैं चाहूंगी इस सेशन के मॉडरेटर श्रीधरन उनके साथ स्टेज पर आए। जोरदार तालियों से स्वागत करिए मिस्टर अनुपम सिब्बल का। थैंक यू।
Good afternoon, everyone. Dr. Sibal, a warm welcome to the TV9 Global Summit, What India Thinks Today. Before I get into a conversation with Dr. Sibal, I'm going to request my audience to give a very warm round of applause, not just for Dr. Sibal, but for the 1.3 million doctors and 3.3 million nurses who work relentlessly over the last two violent, I would say, rounds of the pandemic, the waves that we saw, and worked tirelessly to save millions of lives across the country. So thank you, Dr. Sibal, and your community for all that you've done for us.
And thank you so much for trusting us.
We had no choice. So, Dr. Sibal, 535 million infections worldwide, 6.3 million deaths and still counting. So if there's one thing which the COVID pandemic has proved to the world, is that it doesn't matter if you are a US, a rich country like the US, or a poor country like, let's say, any African country, or even India, an emerging country like India. You cannot ever be prepared enough to deal with a virus like what we saw with the coronavirus. So to your mind, what have you really learned over the last 2 years of dealing with this invisible enemy? How do you look at the key learnings over the last 2 years?
Well, I think it's really been a revelation for all of us in healthcare. Nobody could imagine the scale and size of what we had to witness. But I think if you ask me, one key takeaway that we have, which really applies to us in India, is that health has become center stage. Perhaps if it wasn't for COVID, we wouldn't be talking about health. You'd have more interesting, more important topics. But now, health is part of the narrative every day. And health has become center stage. And what has happened that I think has really changed is that these silos that we had, public sector, private sector, they have broken. And when we managed COVID, the response was unified. And I'll give you a couple of data points. For example, if you look at ICU beds, there were 94,000 ICU beds for patients with COVID. Well, 68% of them were in the private sector. When we look at ventilated beds, there were about 47, again the same ratio. When we look at labs, 3,400 labs, we had about 50-50 private and public. ICMR collaborated with Bharat Biotech, a great collaboration, public-private, we got the vaccine. But when it came to administering the vaccine, we had 1 lakh centers, 98% of them were in the government. If we look at trials, and India, I think, has witnessed more trials. We've actually worked towards developing vaccines, medication, and so on. It's again public-private sector coming together. And, one very interesting data point that, we look at publications and evidence in medicine. So today's day 908 of the pandemic, and there are about 390,000 papers on COVID on PubMed. Mm-hmm. India has 14.1% of those papers, and many of those papers would not have come into existence if the public and the private sector had not come together. So I think that's a big takeaway, and that's going to serve the country really well in the years to come.
So, as you said, this is essentially a wake-up call for public health experts and policymakers. No one around the world expected a pandemic like this one to come along, but when it did, a lot of countries reacted fairly quickly, especially if you look at the pace at which the vaccines were developed and approved. We really crunched time. These are long development processes which take as much as 10 years in a normal course of trials. But we were able to reduce it remarkably to just 18 months. How would you rate India's response and the public policy action that followed the pandemic? Because you were right in the middle of it. And like you said, scrambling for oxygenated beds, for oxygen cylinders, for medicines, for PPE kits.
I think if you look back and see India's overall response, I think we did really well. Look at the size of our population, look at how diverse the population is. We have patients or individuals living in far-flung areas. So it really was about using technology. Let's start with Arogya Setu. It had 100 million downloads in 14 days, the highest ever for any app. Just goes to show the power of the new India. People went on, downloaded the app and wanted to know more about COVID. We created an AI-based COVID risk score because people wanted to know, do you think I have COVID? Because I got exposed to someone who sneezed in front of me. It had 16 million downloads. So I think technology served us really well. Look at COVID. I was traveling overseas and they asked for a paper copy of your vaccine certificate. And then I traveled to Bombay and I didn't know that I had to carry my vaccine certificate. But all I did was show them the app. And there it was. So I think we've done really well using technology to our advantage. But I think the spirit that India has, that, we can overcome challenges because of the resilience that we have. We understand frugal innovation. I mean, you look at the tests that we use, the diagnostic tests. Look at the cost of our vaccines. Look at the fact that we made no PPEs and then became the second largest exporter of PPEs in the world.
Right.
I mean, look at the way medication production, delivery happened. The way we connected with technology through eICUs. No country will have enough intensivists to manage ICU beds. But we achieved that through technology, whereas one doctor could manage 300 patients across 12 hospitals sitting in front of his computer where he has images in front of him of what is happening real time, what's happening to the pulse oximeter reading, what is happening to the ventilator settings, sitting in one location. So I think we did very well. And I want to talk about mortality for a second because a lot was written about it. Please, let's look at mortality rates in countries that had very large numbers. Our mortality rate was the lowest. If you look at, for hospitalized patients, you look at per 100,000 patients who were infected. So I think overall we did really well. And of course, the icing on the cake is the fact that, 87% of our population is vaccinated, fully vaccinated, with 195 crore vaccines being administered. 5 million, a day on an average, more than the population of New Zealand.
That's
so
true.
I think we need to sometimes look at data and say, hey, listen, as a nation, we did really well, and be proud of the fact, because you go overseas and address medical gatherings, and they really are very impressed in looking at the scale of what we did and how we achieved it. And you look at the costs of what it cost them to manage a patient in an ICU with COVID, and what was our cost?
No, absolutely. I don't think there's any doubt about that. And also the fact that given the population density of our major cities, the fact that we didn't witness more deaths, or it wasn't like at the beginning of the pandemic, a lot of countries had predicted that India is probably going to be a disaster. It's going to be a COVID disaster zone. But we proved the world wrong, right? But I'm sure there are hardly any families here whose lives were left untouched by COVID. So I think the question which they would naturally ask is there more to be done to increase the healthcare infrastructure in this country, whether it is hospitals, because I'm sure a lot of families would not be able to afford the kind of care that, let's say, you can, as Apollo, offer. This country needs a lot of public infrastructure investment in healthcare. Do you see more of that coming? We know that in this budget, an 83,000 crore allocation has been made for healthcare. But given India's scale, is that enough? What are the models that we can potentially employ to make healthcare affordable and accessible to everyone?
Absolutely. I think there is a need for us to improve infrastructure. We need to enhance human resources. We need to deploy technology more effectively. And we need a 360-degree approach. And I want to here again review some of the initiatives that have been taken in recent years. And I think we in the healthcare community are very, very appreciative of that. Well, the National Health Policy talks about our GDP spend on the government side to get to 2.5% by 2025. Well, we hope that is fast-tracked, because we used to spend something like 1.1% of our GDP from the government side. The total spend was about 5.5%. So the vast majority was private. So that equation needs to change, because we need to invest more in infrastructure, public health. But I think you raised a very important point, Sridharan, about access. And with access comes affordability. And for affordability, I think the Ayushman Bharat PMJ scheme, which is the largest scheme of its kind in the world, and we know that there are 18 crore sort of individuals who've been enrolled under it. Apparently, by March end, it'll be 30 crores. 25,000 crores have been spent on care, which is very positive. I think the whole digitalization is going to be very important. There are about, I think, 22 crore health records that are available. We have Ayushman Bharat digital mission about the professionals being registered, the institutions being registered. We also have the Ayushman Bharat infrastructure mission, which has an allocation of 64,000 crores. And very importantly, in 600 districts, 30,000 ICU beds will be built, because that is a gap. There are also going to be centers for disease control that are going to be established. And I think with all these initiatives, we will have a situation where the common man can afford care. Because see, healthcare in India is very advanced. But the key is that it must get to the person in the villages. Gandhiji had said the future of India lies in India's villages. So it has to be the last mile delivery. It has to be enabled with our ASHA workers having the tablets, with current knowledge, being able to deliver care, because the community respects them. They are from the community. And I believe the more we invest in this, the better prepared we will be for any such calamities.
So all of us know that India is a software powerhouse. We are a very large exporter of IT services. How can we meld technology with healthcare to do exactly what you're talking about, which is how do we make telemedicine accessible and effective for the poorest of the poor people?
So, telemedicine is something that we've been talking about. For example, at Apollo, we've been talking about for 20 years. Mr. Clinton had inaugurated our center, and we've got centers in the Himalayas. We have an e-Aushadhi program, ophthalmology program, urban health center program, and we've actually touched 13 million lives through telehealth. But one of the things was that there weren't any guidelines. So when COVID struck, the government very quickly issued the telemedicine guidelines that gave a sense of protection to anyone who was doing teleconsults, that this is now sanctioned. I'm a pediatrician. I see patients every day, and I would get patients from Begusarai and Asansol and Tezpur who would spend 15 minutes with me, but would take 3 days coming and going. 4 people would come, because in India nobody travels alone. So so a child, the parents and the grandparents would come. And all you did was just looked at the records. So many times you didn't even need to physically examine the child, because it was a follow-up. And they ended up spending thousands and thousands of rupees. So now telemedicine has totally changed that. The loss of wages, the inconvenience, spending money on guest houses, all that is gone. And the e-Sanjeevani platform that the government has established has now had more than 2 crore teleconsults. In fact, consistently doing 1 lakh a day. In some days in April, they did about 3 lakh consults in a day. So telemedicine is one piece. The second is using the medical expertise more effectively. And let me give you an example. You know, pathology, somebody has a lump, you do a biopsy, you want to make a diagnosis, right? So, you need a pathologist. But there are 13 subspecialties in pathology. Breast pathology, gastrointestinal pathology, liver pathology, kidney pathology. Now, you're never going to get those experts in one roof.
That's true.
Right? So you connect them through a digital platform. They actually look at their laptop and they can report sitting in their house 5,000 kilometers away from someone in Africa to a village in Ladakh. So that's another piece. Teleradiology, and let me give you 2 examples of teleradiology. When someone has a stroke, 2 things need to be done. Either you're going to thrombolize that person because he has a clot, or he has a bleed. If he has a bleed, then if you try and thrombolize, that's going to be disastrous. Now, how do you make this diagnosis? You need a CT scan for this. Now, CT scans available everywhere, but you're not going to get a radiologist at 2 a.m. So what do? You actually take an image, you put it on WhatsApp, you have algorithms that tell you bleed, no bleed. Clotting, okay, thrombolize. This can happen in a rural area. You are not going to have enough radiologists in the country, so someone comes to you with a cough, he might have TB. Well, all you do is run an AI algorithm, TB or no TB, can be done. But extremely important to realize the limitation of AI. For all those who watch tennis, you remember the Australian Open, right?
I remember this one, yeah.
So Nadal is down 2 sets, third set, 3-2 down, 40 love. 96% AI prediction that Nadal will lose. 96%, but Nadal wins. That's the human spirit. So you cannot remove the doctor and get AI to do that because AI cannot have empathy. When you see a doctor, you need empathy. You need the doctor to understand what you're going through. And I want to tell you an anecdote that a friend told me. So she got a call from the hospital where her mother was being treated, and the doctor said that, your mom's really sick, you need to come. Please bring your brothers and sisters because she's deteriorating, you need to have a family meeting. So she took her brothers and sisters, they went to the hospital, and the intensivist said that your mom's not well. She's deteriorating. Most probably she's going to need dialysis. She'll go on to non-invasive ventilator and then a ventilator. So while this conversation was happening, the physician who was looking after her, and this was coming from the intensivist, said, but what does mom want? And nobody had asked mom. So my friend was asked to go and meet her mom, and she asked mom, what would you want? And mom said, I've had a beautiful life. I have grandchildren, I have great-grandchildren. I want never to go onto a ventilator. I want to pass away peacefully in my room surrounded by my grandchildren. And that is what was decided and done, and she passed away peacefully. So my friend said that day I realized that there were 2 types of doctors. The intensivist was the doctor of her body. He knew exactly what was needed to care for her, but her internist was the doctor of her soul. And we as clinicians need to be doctors of the mind, soul, and the doctors of body, and AI cannot achieve that. So I think we will use AI effectively, but the human touch. So get high tech, but remain high touch.
Talking about this, absolutely. Talking about this old lady, I'm reminded of the reports that were coming out of Italy, the height of the pandemic, when doctors actually had to make a choice between putting an 80-year-old on a ventilator or a 25-year-old who's just come in. I hope no doctor ever has to do that,
Yes.
Yeah. But the fact remains, telemedicine, while it's definitely going to be a supplement and it's going to help India deliver healthcare to the remote parts of the country, the fact remains that we need more doctors and nurses. Yeah. So how do we overcome that constraint that we're not producing enough doctors? And all truth be told, it's a great profession. I mean, people should be aspiring for, these jobs like being a doctor or nurse.
Absolutely. I was just looking at, I do this every year, so I looked at 2022 data on how many class 12 students sat for the entrance exam for medicine. So 1.8 million. So 18 lakh kids sat for the exam. We have 90,000 seats. So 5% will get into medicine. Now, let's assume that out of the 18 lakhs, many were beaten into it by their parents. Okay, you know, my bhatija did it, so you also have to take the entrance exam, and you know, it's very honorable to take this exam and become a doctor. And then, of course, we have this thing in India about mera beta mera naam roshan karega, mere beti mera naam roshan karegi, so medicine karo. But let's discount that. So even if a few lakh go, but only 90,000 get in, so there's a huge potential. So what do we need to do? We need to build a lot more medical colleges. And I have to say, in the last 8 years, you know, we had 54,000 MBBS graduates. Now we have 90,000. We've got 600 medical colleges. The government's opened 100. The private sector's opened 50 more. And the target is really to get to 1 lakh. But what we also need is more specialists. The specialists have gone up from 35 to 45,000, but I think we need 1 lakh specialists. 1 lakh MBBS, 1 lakh specialists, because medicine is too complex now. You just can't do MBBS and manage a patient. If you want to be a family physician, you need 3 years more of family medicine. If you want to do pediatrics, obviously you need 3 years and so on. So the ratio should be 1:1. In the US, it's 1.1 to 1. There are more specialists than MBBS. So that's something we need to do. There are 75 million people in India with diabetes. Okay?
We are the diabetes capital of the world.
And how many endocrinologists do we produce in India? 93 every year. 45 million people have cardiac disease. How many cardiologists do we produce? 630. How many cardiac surgeons do we produce every year? 260. So you can see the gap. So how do you bridge this gap? There is no shortage of patients. So what you need to do is build more lecture theatres. In the University of Queensland, they train 400 MBBS students. In universities in England, they train 400 MBBS students. In India, the highest is 280. Why can't we make it 400? We have 1,800, 1,900 bedded hospitals. So all we need is lecture theatres. Most of the time is anyway spent after the first 2 years in hospital. So we need to think like this.
Right.
Then 97,000 Indians have acquired MBBS degrees in 60 countries. And I know Ukraine was talked about, and you know, it became very important. Now these kids went abroad. Sadly, only 16% of them have passed the Indian exam to work as a doctor, so they can't work as a doctor. So what we need is a course for them to come to speed with what Indian medicine standards are. Let's do 6 months, 1 year, train them, let them meet that benchmark, pass the exam. But why should these kids be going abroad? So they should be trained here. And I think so we need to build capacity. Similarly for nurses, we have a shortage because the career graph for a nurse is rather flat. She starts off as a staff nurse, then becomes a team leader. And then what happens? But why can't she be a nurse manager? Why can't she be a nurse practitioner? Why can't she be, you know, helping clinicians do stuff that they can do so well? So we need a career graph for them. And, you know, there's a bill that's going to be passed. Hopefully that will happen. The same for technicians. So I think we have this huge, huge ability in that medicine is a respected profession. So we need to encourage young people to join this profession, but have a very robust growth curve for them. You know, kids today, when we did medicine, our perception of medicine was very different. The kids today look at number of hours put in, and what do I get at the end of 2 years, 5 years, 10 years?
Right.
And quite often we can't give them that answer. So we need to start giving them that answer. No, it's 2 years and an MBA, no? And you know very clearly what happens. You'll get a campus recruitment and so on. So we need to start talking like that in medicine as well.
Right. But purely on a lighter note, I think we are producing a lot of doctors, except that these doctors on the Google University, which I'm sure Dr. Sibal probably sees a lot of every day when patients walk in and say, Doctor, I think I have a heart problem, and it's probably just something.
Yeah, absolutely. And you know, on this, they say if a doctor falls ill, say a doctor develops a medical problem, and you know, even doctors go on to Google because it's just so easily available. And you go on and you'll be horrified to see what you find. I'll give you an example. I saw a child today with wheat allergy and done an endoscopy, diagnosed wheat allergy, celiac disease. I've been doing this for now 27 years. And if you go on to Google, you type celiac disease, one of the things that comes up is gastric cancer. A cancer of the GI tract. In 27 years, I've never seen a child with celiac disease who's developed cancer. Because you won't if you're on the diet. But the first thing is to the mother who's done a Google search says, will my child develop cancer? Poor thing is petrified when she comes and sees it. So there are a lot of pitfalls with getting information through unverified sources. And it's very confusing. Like I told you, there are 380,000 papers on COVID. And
Right.
these are peer-reviewed, published papers. So you can just imagine how many billion data points you'll have on anything medical.
But the reason I made that slight joke is basically drive home the point that how in the post-COVID world, people are more paranoid about their own health. You know, someone sneezes, you think, okay, this guy's got COVID. You know, you have some trouble breathing, you think, okay, I'm going to have a cardiac arrest. So one thing is to basically like self-treat and like get into a panic mode. But what's also happening is a good thing. People are becoming more aware of the need to remain healthy. So what would you advise people, many of them who probably could benefit from the advice here, how should they take care of their own health? What are the symptoms, what are the signals they should be alive to? And what kind of a routine should they follow so that the basic health remains in good shape?
See, there are some conditions. So basically, you see, we are what our genes are, what we breathe, what we eat, and what we drink. Genes we cannot change. I won't get into breathing because, that's another subject here with pollution. But definitely we have some control over what we drink and what we eat. So there are several things that we are doing wrong. We are consuming tobacco. We are drinking alcohol. We don't exercise. We eat dinner at 10 p.m. Body cannot handle it. Body cannot handle dinner after 7 p.m. You have to have 3 hours for the digestive process to actually do its job. And that's how you put on weight. We eat wrong stuff. We've forgotten about the Indian thali. It's beautiful. In about 950 calories, it gives you 55% of your calories from carbohydrates, about 30% from fat, and about 18% from protein. You have dahi in it, which is great with probiotics. You have salad, and then you end that with perhaps some fruit. So, if you eat that kind of a meal, you're protecting yourself. But you also have to get preventive health checks done. Quite often I ask friends and colleagues here, so everybody knows when their car needs to be serviced. And you ask them, when was the last time you had a health check? But why do I need a health check? I'll go and see a doctor when I'm unwell. The whole idea is see a doctor when you're not unwell so that you don't become unwell.
So how often should one...
So an annual health check for anyone older than 30. You'll say 30? Yes, we've seen boys and girls drop dead with a cardiac disease at 27. So we have a predisposition to heart disease. Our lifestyles are unhealthy. There's too much stress. Obesity is on the rise. So everyone should have an annual medical after 30. And that medical should also include some basic tests for cancer because we have a big problem with cancer. About 8% of our population has abnormal sugar profiles. So we need to counter these non-communicable diseases by healthy lifestyle and health checks. And if you do that, you pick up things way early. What is the point of picking up kidney disease due to high blood pressure because nobody checked your blood pressure at the age of 25? So sad. You're going to at 45 develop kidney problems and heart disease. Or nobody checked your lipid profile and so you're going to develop coronary artery disease, which could have been controlled with exercise, better diet and perhaps statins.
Right. So, Dr. Sibal, I'm sure a lot of people here are also worried about the long COVID phenomenon. These microclots which probably still remain in your body. So how do I make sure that any symptom that I'm really feeling or some health concerns I have is not really long COVID? How do I...
I think, what happens is, and I think this is the problem when you have access to so much information. And when you look at vaccination, and you as a journalist would remember, there was this huge thing about nursing homes in Norway where the elderly were dying because they had been vaccinated. And when you actually did a deep dive, you discovered that the rate of death in those elderly people was the same with or without the vaccine. So not everything that we see, is, even if you've recovered from COVID, is related to COVID. There are a lot of other things. So the best thing is, instead of trying to do a search, please see a physician. If needed, there'll be some tests done. But one of the things that we have to realize is that no test should be done unless it's absolutely essential. The purpose of a test is to confirm what you as a doctor are thinking.
Right.
If you haven't thought of it, don't order a test. Little kids get CT scans done and get exposed to so much radiation for what?
Right. So tests as opposed to checkups.
Yeah, checkups when decided in consultation with a physician, but certain basic tests like a sugar profile and lipid profile is in terms of a part of a preventive health program. Like we have a pro health program at Apollo based on 39 years of preventive health checks. It's It's again AI driven, it's personalized, it's individualized. We look at your profile over the last few years and say, okay, you need this time. Next year you might need something else. It's personalized. Personalization of medicine is going to really make a big difference.
Right. So can you talk a little bit more about that? Because that's actually the emerging field in medicine where my medicine may be very different from, let's say, your medicine that a doctor
absolutely
prescribes.
So, let me give you an example. So, you want to buy a suit. So, you either go to a tailor or you buy a ready-made suit. Now, what are the odds of your ready-made suit fitting you precisely? Either the sleeve will be long or there'll be something wrong as far as your body type is concerned.
Right.
So, you'll need a bit of alteration.
Not made for you.
Yeah, absolutely. Because one size does not fit all.
Yeah.
Personalized medicine is tailoring medicine to you as an individual, very simply put. Because what you need to look at your genomics, you need to look at epigenomics, you need to look at what diagnostics would be relevant and then decide what is to be needed. And let me give you 2 or 3 examples. And I think this will perhaps resonate with everyone because when Angelina Jolie decided to have a bilateral mastectomy because she had BRCA1 gene which predisposed her to breast cancer, there was a lot of talk about genomics and personalization. So there are 33 types of cancer today where genomics decides what medication to give. Just last week, there was a paper published on colon cancer where there was 100% survival in individuals with colon cancer with a new drug used for 6 months. But what is very important is that drug only worked in individuals who were MMR deficient. This is a mismatch repair gene. So if you're deficient in that, it works. But if you're not deficient, that drug is useless. So you can't really use it. So that's where genomics comes in. There are about 250 drugs that we use in practice where the genes decide whether it's going to work or not work.
Right.
Second, is it dangerous to give it or not? Like statins and leg cramps. Azathioprine is a medicine that we use often. It can suppress your bone marrow and your blood counts can become very low, platelet counts can be very low. There are certain medicines, depending on your genetic makeup, that can be metabolized very quickly, so you need higher doses.
Right.
So personalization is going to be the way forward. It's very much in its infancy today, but I think a decade down the road, we're going to talk about it a bit like, we're going to talk more about technology. For example, when I was training, a gallbladder used to be removed through an open surgery, which means you went home after 7 days. Then came laparoscopy, you go home the same day. Similarly, we will now have robotics. In robotics, the percentage used went up from 1.8 to 18% in 5 years.
Right.
So I think this whole thing about using technology effectively, personalization, individualizing, tailoring your treatment options to who you are is going to be the norm.
Right. But isn't this a little controversial, like what Angelina Jolie did, which is after she found out she has a predisposition to breast cancer, she got her breast removed. Is that something a doctor would advise? I mean, just because you have the gene doesn't mean you're necessarily going to get it. Because from some of the literature that I've read, all of us have rogue cells in our body.
Yep.
So which means many of us will die with cancer, but maybe not die of cancer.
No, I think, Sridharan, you've summarized it beautifully. There are a lot of ethical questions about it, and we don't know enough. And nothing in medicine is 100%. Nothing is ever 100%. So it is really about, okay, this is your risk profile. You share this with the patient the way you understand it, and let the patient decide what is right. 2 patients in the same situation with the same results will decide to do things differently. And that's why personalization also has an element of how you look at life.
Right.
The glass half full, half empty, or it's full, half water, half air.
Right.
So, 3 different perspectives.
We have a couple of more minutes, Dr. Sibal. So I'm just going to ask you about this whole emerging field of medical care or wellness, I would say, about holistic healthcare. What is that exactly?
So I think holistic healthcare is extremely important, and I think we in allopathy, because our understanding of Ayush, Ayurveda, Yoga, Siddha, Unani, homeopathy is very low, we don't quite understand that. And I think we have to realize that at the end of the day, it's about keeping him well. So if it is a combination, it's integrative, it's holistic, it's better. We saw a beautiful example with Miss Rosemary, who'd lost her eyesight because of optic atrophy, because of tumors, the daughter of the Prime Minister of Kenya, who got cured by Ayurveda. She tried everything everywhere.
That's right.
That's so beautiful.
It happened in Karnataka, by the way.
Sorry.
My state.
My apologies in getting the state wrong.
Yeah.
170 out of the 190 countries in the world recognize alternative systems of medicine. 175 countries recognized International Yoga Day when India passed that resolution. And now with this global collaboration with the WHO and the government of India setting up the Traditional Medicine Center in Jamnagar, I think we're going to get a lot of robust evidence on how this system works and integrated. I think holistic care is very important, and I think the more we embrace it with open arms, the better it will be for all of us.
Right. So yoga every day is a good idea, you're saying.
Absolutely.
Fantastic. So hopefully we will not have another pandemic like what we've seen, but then who's to say? How prepared do you think India is now to deal with, God forbid, another pandemic like this one came along? Are you more confident about the healthcare system's ability to deal with it and with fewer mortality and better results?
So let me first answer that question as an Indian citizen who's very proud of being an Indian, that I think we have the resilience which we demonstrated. We have this attitude, this spirit that is going to see us through. Of course, this needs to be backed with action on the ground, and I shared some of that with you. The fact of the matter is that 50% of the world's vaccines are made in India, 40% of generic medicine in the US is made in India, 25% of all medicines in the UK are made in India. We have the demographic dividend. We have the ability to not just heal India, but heal the world. You know, we are going to put in 22 million people in, 22% of the workforce is going to come for India, from India in the next 30 years, because we are a young India. So let's train more, heal more, and also heal in India using traditional medicine, using all the advantages that we have with the high value, competitive cost. Because our outcomes are excellent, our cost is 1/5 to 1/10 of the world. We've treated patients from 140 countries. We should be healing more than anyone else. I think there's tremendous potential for us to do that. And I am very confident that India is going to occupy the position that we richly deserve at the high table when it comes to medicine. Our doctors are absolutely world class. As our infrastructure improves and as we start thinking more and more about health, we're going to be right up there.
Right, fantastic. So final question. So our theme of the summit is basically Vishwaguru. So if India is to become a global leader in healthcare, how will it really look? Are we talking about becoming a destination for treatment, like we are already a destination for medical tourism, right? But are we also going to become innovator of drugs, like in the case of the COVID vaccine? We made vaccines and we supply to the rest of the world. We are already large in terms of a pharmaceutical supply, but maybe not so much in terms of formulations, maybe bulk drugs, and generics for sure, but not in terms of innovative new medicines like blockbuster drugs. So how will this whole Vishwaguru status of India in the healthcare space look from your perspective?
First of all, we will be Vishwagurus, and it will happen in my lifetime, hopefully.
Fantastic.
You know, it took the world, COVID, to realize Vasudev Kutumbakam, that we've believed in. And we've actually demonstrated it. We gave out 16 crore vaccines through Vaccine Maitri to 100 countries. That just shows the power that India has. We are going to have Heal in India. We're going to treat patients. We will heal by India, which means we'll produce technology, medication, we will produce innovative medicines, we will produce whatever it takes. So we will heal by India, but we'll also produce the human resources if we get it right, and there's no reason why we shouldn't get it right, by actually pushing out our trained healthcare professionals who will go abroad and look after the aging world. So young India will look after the aging global citizen, and they will send out billions and billions of dollars. We have the highest remittance in the world, even though there are 5 million more Chinese outside India than Indians outside India. And I think that can increase phenomenally if we use our human resources better. And because, you know, we run an organization called GAPIO, which is the Global Association of Physicians of Indian Origin, and I have the privilege to be president. We have 1.4 million doctors of Indian origin in the world. We have members in 54 countries. They occupy the highest positions. And for our 10th conference, the Honorable Prime Minister sent us a message. And he said, our world view is ingrained in our ethos of Sarve Bhavantu Sukhina.
Absolutely.
Sarve Santu Niramaya. May everyone be at peace and may
Absolutely.
no one ever have illness. And that is what Wish Guru is about.
Absolutely, and that's really the true spirit of India, isn't it? Yeah. So, Dr. Sibal, thank you very much. When I look at professionals like you, I know that India's healthcare is in very safe hands. So, thank you so much for joining
so
us.
much.
Ladies and gentlemen, a big round of applause for Dr. Sibal, please.